Do you have any health conditions or injuries I need to be aware of?
Yeah, so I'm on a little bit of blood pressure medication and cholesterol medication. My shoulders are a little bit tight. I feel like I can't get them back as far as I used to be able to get them back.
Maybe tell me a little bit about how active you were in the past.
Yeah, I played varsity ball in school, so I had to exercise a lot for that. And then after I was done, I joined the military, which was also very physically demanding, and we had to do a lot of exercise.
So you could say you're used to doing physically challenging things.
Yeah, and I would say that I was in better shape and stronger than most of the people I played sports with and that I worked with.
Okay, so we're going to see what your starting point is for the push-up. Now, these are going to be done a little bit differently than you're probably used to, but I find it's a more effective way of doing it to get your chest, your triceps, your shoulders involved and to use all of the correct muscles. So what we'll do is I'll have you sit down, lay down on your chest like this, bring your hands just a little bit wider than your shoulders or right underneath your shoulders. You're going to squeeze your glutes and then push from under your armpits on the way up like this. And then we'll lower yourself back down until your chest touches the floor and push yourself back up again. So it'll look kind of like that. And I want you to just do as many as you can. Wow. I've never really done push-ups like that before. It feels a lot different. So how did I set this client up for failure? Well, in his mind, or I'm assuming, I have to assume, in his mind, that doing regular full push-ups from his feet is really the only way to do push-ups based on his history of being a varsity athlete and being in the military. He probably did a lot of push-ups. Now, based on his demographic and his assessment, I made the reasonable assumption that he probably can't do push-ups from his feet anymore, or if he can do push-ups from his feet, it would not be very many and they would probably be very sloppy. And if I were to go to an easier progression, like from the wall or on the stairs, then there's a very good chance that that would be too easy. Or conversely, if it wasn't too easy, if it was really, really hard for him, then that might be too demoralizing for him, or it might be so demoralizing that in his mind he might not even feel that it's worth it to be able to continue exercising, because he might just decide that he's going to throw in the towel, that that's too far to climb from a wall or a stair push-up to a push-up from your feet, which is why I chose the kneeling push-up. And on top of this, I modified it in a way that, well, I modified it to make it what I would consider 100% the correct way to do a push-up, because in the past he was probably not used to doing push-ups with correct form, or what I would consider correct form to get maximal muscle activation. So in that way, I made sure that he was doing proper mechanics right from the very beginning, and it was a variation that was just hard enough that he could do some, or that I guessed that he would be able to do some, but not really that many, while at the same time showing him that there's definitely a clear path to improvement, because he's very familiar with push-ups from his feet. So he can see that he can only do some kneeling push-ups now, but the next progression up is push-ups from his feet. So in that way, I set him up for a little bit of failure, but with the vision of having this very attainable next step that would basically be setting him up for success.